Hi, I'm Matt, and I'm with Occupational Therapy, and I wanted to share with you today some principles that are going to help you manage your pain or actually treat your pain. So you might be wondering, well, why are we actually talking about pain physiology? The reason we're actually talking about it is because when we understand pain physiology, how pain comes and how pain goes, you're able to manage pain better and you're able to actually need less pain medicine. So that's what the research actually shows. And if I had a show of hands out there, how many of you know how pain comes? You would probably say yes. But if I were to ask you, how does pain go away? You might ponder that a little bit and wonder, how does that really happen? So today I'm going to actually show you from a physiological standpoint, how does pain go away? What's really nice about this program and what we're really excited about is that when you understand how pain goes away, you can make it happen quicker. All right, so some of you out there are having hip and knee surgeries, having spine surgeries or shoulder surgeries. We've seen these techniques and our understanding of pain physiology really make a difference in the outcome, okay? So that you can be back to your life again. Now, some of you are going to even see more function than you did before the surgery, and that's probably part of the reason you're here. But I want you to understand that if your pain's not under control, we can't really talk about function. So it's really important that we actually do the best that we can to help your pain be under control, okay? So I'm going to go right into the research right here, and in the next slide, you're going to be able to see some pictures of some brain scans here. So imagine if I were to look at you and say, oh, your pain's a 5 or your pain's a 3, and I can treat you accordingly, but really there's no way to do that. But these researchers did the next best thing. They actually went ahead and took these MRI of an individual who was having low back pain. So they were seeing results, great results from all these back pain patients. And they said, how could we objectify these results? So what they did was they actually took this individual under a functional MRI and they had them do an abdominal drawing in task. And as they did the task, there would be pain associated with that task. And so those red areas that you see in the first slide there, those red areas are not pain areas. Believe it or not, there's actually no pain areas in the brain. There's actually decision-making centers. So, for instance, if I were to stick my hand in a flame and my brain would say, no, 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 right? Those decision-making centers would light up, those red areas, they would light up and say, no, no, no. Same thing, can you imagine if you're after surgery and you're trying to get up for the first time, you move that leg or hip or, just go ahead and get on up from bed, that brain's going to say, no, 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 right? So we're going to actually show you some strategies to help you work through that pain and again, have you have a better outcome. So going back to the slides here, or actually back to the MRI, if you look at the second slide there, you will see that those red areas, as a function of time, because that was 6 days later, you can see the red areas go down a little bit, but they're still present. Now, in the third slide, I want you to notice the difference that the red areas are no longer there. So what happened between the second and the third slide, you might ask? Well, really what happened was that what once became a threat no longer was a threat to this individual. And how can we apply that? I'll give you a perfect example. We had a young lady sitting over here, relatively young, in her 50s, who said, basically, when she heard this information, or actually before she heard the information, she had a lot of trepidation. Do I even want to go through with the surgery? She came to me after the class and she told me basically, Matt, I really didn't want to even go through the surgery. I thought about canceling it. After I heard this information, I felt like I could do the surgery tomorrow. So you see right there how just having an understanding of pain physiology can reduce the threat. And that's exactly what happened with this individual in the brain scan. We didn't share any techniques. It was just a pain physiology course. Now, albeit it was a couple-hour course, we've gotten pretty good at truncating the information and just doing it in about 20 minutes. Okay, so we're going to go ahead and get started right here. And I'm going to break this up in a couple of parts. I'm going to show you the pain physiology portion. And then after sharing the pain physiology portion, we're going to share a couple of the techniques that we do to help you treat your pain. Okay, so here we go. You ready to never see the pain the same way again? What's really great about this, it takes a lot of the mystery out of pain. Some of you might say, well, I woke up with more pain than another, or some surgeries might have the same, you might have 2 knee surgeries and one has a 6 out of 10 pain, one has a 2 out of 10 pain. What's actually going on? So you'll have a better understanding after this information. Okay, so here we go. So in the next slide, you see a depiction of a nerve. And I'm going to draw a close-up of this, and that's a peripheral nerve. Okay, so we're going to go ahead and draw this right here. Okay, here's your nerve going into the spinal cord, and here's your brain. Okay. So when you have let's say you burn yourself or you injure yourself, or in your case, you're going to have some surgery. What's going to happen is that the brain at that point, when it experiences some inflammation, some damage to the tissues, it's going to make what's called these sensors. Okay? And the more sensors you have, the more signals you have coming through. Think about these sensors. Sensors are having sort of cameras looking at the tissues, making sure that everything is okay. Okay? And so the more sensors you have, the more signals coming in. If enough signals come in, right, the nerve spikes, sends a signal up to the brain, and the brain says, no, 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 right? And it actually, what it does, it says it's going to make more sensors to protect and guard this area, as long as what the brain sensed was a threat. Now, if I took my hand and I touched your shoulder, hopefully that wouldn't be a threat. So the brain would get that signal, but it wouldn't make more sensors because it wouldn't be threatened by that motion. But, you know, after surgery, of course, the brain's going to be a little bit more protective. Or in the case of some of your surgeries, some of you may have been dealing with pain for many, many years, maybe 5, maybe 10, sometimes longer. And so in those cases, the brain will be more protective of that area. So I really want to get this understanding to you, is that what can we do to help the brain let go of this area? Basically what I want to do is I want to actually send the brain packing. Okay? It's a suitcase there where I want the brain to basically go on vacation. Okay? So if I can get the brain to stop making sensors, your pain will be much sooner to be dissipated. Okay? So before I share with you how that happens, there's something very important you need to understand. These sensors have a lifespan. Okay? Once they're gone, but you need to understand how long they live for. Now, when I went to school, we didn't really have an understanding of all this stuff. In fact, we've learned more about pain in the last 15 years than the last 1,000, because we can see into the tissues and our understanding's a little better about what's actually going on. So these sensors have a lifespan. So think about how long would you think that they would live? Any ideas out there? So the actual answer is that they actually live for about 24 to 48 hours. Isn't that actually great news? Because if you think about it, if it lives for 24 to 48 hours, you know that the next day or two, things can be significantly better. Now, of course, they can be a little worse, but that usually doesn't happen. The way the body works, the way the body's designed, it's created to help pain go away, okay, within a certain amount of period. Now, there's a really, really significant question here. If in 24 to 48 hours the sensors are gone, why does someone still have pain? So think about that for a second. So the answer is the reason we still have pain after the 24 to 48 hours is the brain keeps making more sensors. Now here's the point. Really hear this. If it thinks it needs to. If the brain doesn't think it needs to, if it's not threatened, it won't make the sensors. But if it thinks it needs to, it will continue to make it, in fact, for the rest of your life. So in the case of your tissues, if this area around your nerve is healed, if the brain doesn't want to let go of it, in fact, insidiously, it can keep making those sensors. This is where chronic pain comes in. This is where you've heard of phantom limb pain, where the arm or the leg is missing. The brain can still continue to make sensors, albeit virtually, even if the limb is not actually there. Okay? So this is how pain comes. This is your pain cycle. But how does pain go away? That's the big question that we want to talk about. So before I go ahead and share with you, I want to talk to you about two ingredients that really make the difference, okay, around the tissue, okay? So those two ingredients, okay, number one, okay, I put it right here, that's the amount of oxygen. Number two, the amount of blood flow. So really, if you don't get anything out of my talk, I want you to remember this. If I can get 10 times more oxygen and 10 times more blood flow, my goodness, your brain's going to say, why am I even here? I'm going to actually start letting go of those sensors, stop manufacturing those sensors, and you're going to be on the other side a lot quicker. Okay? Okay, so we're going to actually take a pause now, and we're going to actually talk to you in a second about how those those strategies that we can do to help increase the oxygen in the blood flow. And that's going to be done at rest, you guys. So there's some things you can do while in bed or in the chair to help your oxygen and your blood flow. And then we're going to talk about what you can do when you're moving. Okay? So stay tuned. Okay, so let's talk about the oxygen piece now, okay? Remember, we're talking about oxygen and blood flow. We're talking about the oxygen right now. Here is your lungs, okay? Here's your trachea. Think about an upside down tree, right? That branches goes into the right lung here, okay? And here's your left lung, okay? And the branches kind of go on down in there. Okay, so these branches terminate into these sacs, okay? Some of you may know those sacs are called alveoli, okay? Now, why are the alveoli important? That is your site of gas exchange, okay? So basically you want to go ahead and when you take that breath, most of you, I'm not picking on you, but 95% of us are pretty much only using this portion of our lungs. Okay? But here's what's interesting is when we're stressed, let's say traffic or pain or taking a test, things like that, we're maybe even using even less. Okay, so what's happening is that we're only using this portion of our lungs. What's the actual consequence of that? I want to show you is, let's take a close-up of the alveoli right here. When you take that air in, and again, it's a place of gas exchange, and you take the oxygen in, what gets displaced? Some of you know that that's carbon dioxide, right? So, as CO2. Now, if we don't actually get the oxygen down into the alveoli, the CO2 does not get removed. And folks, the only place that's carbon dioxide is removed is in the lungs. So if it doesn't happen there, the body's got to do something with it. And in fact, if you don't actually get rid of the carbon dioxide, it'll actually start to build up, okay? So if you think about it, if you're not using this area down in here, the carbon dioxide just kind of building up, okay? And it can cause that panicky feeling, nervousness, things like that because of that carbon dioxide. In some instances, we've actually found with some folks that when that carbon dioxide comes even out into the bloodstream, okay, it actually signals the amygdala or actually your fear center. So again, you kind of feel that panicky feeling when you got that too much carbon dioxide going on, okay? So when that carbon dioxide comes back out into the bloodstream, it's hoping that when it comes back around that you will actually get rid of it. But here's the thing, if you don't get rid of it, it has to do something with it. If it actually comes into your bloodstream, it changes your pH, makes you more acidic. You will literally die if your pH changes in your blood. So what it does, the body's designed to do to kind of prevent that is it'll actually dump the CO2 into your tissues in the form of lactic acid. Okay, and that's where you can experience that soreness, that tightness. In some cases, we've actually had research that shows that some folks have 200 to 300, not 20 or 30, 200 to 300% more lactic acid in your tissues. So sometimes if you just decide, hey, I'm just going to go ahead and exercise, and you don't take care of the lactic acid piece, you can get even more sore. So you can understand why it's so important to take care of this piece. Okay? The other value of what I'm sharing with you is I want to teach you how to actually, instead of just using this portion of here, I want you to go all the way down here and all the way up here. All the way down here and all the way up here. Now, folks, hear this out. When you actually do that, this is so powerful, it actually activates the vagus nerve. Not Las Vegas, V-A-G-U-S. Okay? Now, when that happens, you get put into what's called that parasympathetic state. Instead of, how many have heard of the sympathetic or the parasympathetic? Sympathetic, you might have heard of the fight or flight, that guarded, tense state, right? So as soon as we get into that state, we kind of get into that shallow breathing, tightness. Some of the symptoms you might experience with sympathetic state is restless legs or hands and feet being cold, or you might actually feel like you're having trouble sleeping at night, low energy, headaches, more irritable bowel. You might grind your teeth. You might have more cramps. All these symptoms are associated with being in that sympathetic state. I want you to be in what's called that parasympathetic state, okay? And in that state, okay, is otherwise known as that rest and digest state. In that state, what's really neat is, remember the sensors that I drew? The brain really has no ability to make sensors, or doesn't need to make sensors when you're in that parasympathetic state, okay? So, how do we actually get into that parasympathetic state? You might ask, well, you're going to get to it if you sleep deeply, maybe if you have a nice massage, or you're laying in a hot tub, which you can't do after your surgery. So the other way that you can get into the parasympathetic state is to actually activate the diaphragm and use your lower lung. So I'm going to show you how to do that in just a moment. And we'll have some handouts for you as well that kind of go over how to do it. But basically my whole point is that I want you to go ahead and get all the way down here and all the way up here. And that's how you get that. Some experts say you can get 10 times more oxygen just by being able to breathe that way. So I wanted you to think about why we as human beings yawn. You ever wonder why we do that? The reason we yawn is because as the day goes on, we get depleted of oxygen. Our body yawns to make up for our lack of it. And get this, the body knows how to do it better than us. Because usually when I ask someone to take a breath, okay, usually this is what I see, okay? I'm not picking it, just what I see. But I usually have someone take that breath and you'll see this happen. That chest rise, right? And so when you do that, you're really working this area right in here. You're not really actually working the lower. And not only are you not working the lower, you're not activating the vagus nerve. So the reason yawning feels good when you do it is because you actually activate that vagus nerve and you get more oxygen. So if I were to do a fake yawn, it would look like this, okay? So look at my tummy right here, right? Instead of up here, watch this here. I'm going to do a fake yawn. And I've been talking for a while, and when I do that, I could just feel everything just kind of open up, okay? And so when we actually activate that, we're actually calming things down. Again, the rest and digest state, right? To give you a quick story about an individual, somehow, unfortunately, she fell through the cracks. I walked in and gripping the bars of the hospital bed and really in that tense, sympathetic state. And about 3 days later, I taught her how to actually activate that diaphragm, get that body to calm down. And get this, this is what she told me after that. Matt, after we started doing that, this is the first time in 3 days that I felt open, right? And so when your body's able to get the nourishment it needs and you get that capillaries to open up and send that oxygen and blood flow to that area, my goodness, you're on your healing phase, the rest and digest state, instead of that sympathetic guarded tense state. Okay, so you don't necessarily have to do it like a yawn, but it's actually best and most relaxing to do it in through your nose. It helps you sleep better at night. So what I want you to think about is in through your nose. Okay, watch this. Hold it for about a second, and then 3 to 4 seconds out. So the whole process should take about 6 to 7 seconds. And if you're only able to do it once or twice or a few times a day, it's not really going to help. So I really encourage you to do it every half hour during your recovery phase until the pain's pretty much gone. Every half hour, not for a whole half hour, just about 10 breaths. Okay, and that'll actually, again, signal the brain, right here, okay? Signals the brain to actually stop making the sensors because oxygen is so relieving to the system, okay? So that's the oxygen piece, okay? You get 10 times more when you can actually activate it and do it the right way. So that's the first piece. Now the second piece I want to talk to you about is the blood flow piece, okay? So think about blood flow. There's a difference there between systemic blood flow and local blood flow. So if I'm walking or if I'm kind of running or things like that, I might actually get systemic blood flow. What I want to talk to you about is about local blood flow. So for you knees, right, I want you to think about how can I get more blood flow to my knee? How can I get more blood flow to my hip? And for you folks with the shoulders and the back, how can I get more blood flow to those areas? Okay? Now, with the shoulders and the backs, we're going to go over some precautions. There's things that you're not supposed to do, and we can talk to you about them later. But typically, ultimately, you got to realize if I can get more blood flow to that area, that's going to help that pain go away. And of course, you can do the oxygen anytime. Okay. Now, if I wanted 10 times more blood flow to the area, how would I do it? Okay. So again, walking will give you maybe twice as much, which is still good. Okay. So for you shoulders and you backs, that's going to be especially important to get that blood flow. But if I wanted to get more blood flow, especially to my knee and my hip, I got to get that area to contract. So get this, right? If I can actually get that muscle to contract around that area, I can go from 1,100 milliliters of blood flow to 12,500 milliliters of blood flow. Isn't that great? So that's how wonderful the body's made. So if I wanted, for instance, if I wanted to get blood flow to my bicep, and you know this when you're giving blood, what do they ask you? They ask you to pump. What happens when you pump? The veins gorge and you get more blood flow. But if I wanted to get more blood flow to my bicep, would this be the best way? Actually, no. If I actually went ahead and contract that muscle, now I can get that much more blood flow to that area, 10 times more, going again from 1,100 to 12,500. And so when the brain receives that blood flow, again, it's like, well, I was threatened before because, you know, when we're in pain, we kind of tense up, guard up, and there's not much happening. But when you get things flowing in there, boy, oh boy, then the brain says, why do I need to stay here? Again, I can pack my bags and go ahead and go on vacation, okay? So does that make sense how if we can get 10 times more oxygen, 10 times more blood flow, you will really help that brain to make those sensors, okay? Now, we're gonna move to my favorite part, and my favorite part is, in the next slide, you'll see a diagram here of what's called the sensory motor cortex. If you're wondering where that is in the brain, it's right here along this strip, okay? So that strip actually represents every single body part. So from the top, you can see where the foot is represented. In the middle, you can kind of see where the face is represented, and you can see the tongue and so forth. All these, every single body part is represented in the brain. But here's what I want you to get at. Some body parts are represented more greatly than others. For instance, if you look at your feet and your hands, they have a lot more space than other body parts. For instance, look at your forearm, okay? Your forearm is 3 times bigger in real life than your hand, but in the brain, in the diagram there, you can see the forearm is 3 times smaller than the hand. Now, why is that? And you know, it's because the hand has a lot more sensory and motor nerve, and we use it more. In fact, the thumb is the most sensitive digit. 70% of the movement when you move your hand is your thumb. That's why you can see the thumb depicted more greatly. So I was looking at this and it just dawned on me, oh my goodness, wow, this is why babies suck their thumb. Look at the thumb, the lips, and the tongue. Wow, now that baby's very distracted and it's feeling better. I'm not going to actually have you do that. I need your hands on the walker. But what I am going to actually show you is how we can actually use this diagram or this understanding of pain physiology to your advantage. So looking at this diagram, again, which body part is the most sensitive? Again, fingertips and feet are number 2. Looking at this, which diagram is the most sensitive part of the human body? It's in the face. That's right. It's the lips. The lips, in fact, are the most sensitive part of the human body. So if I were you and I wanted to distract my brain, and the brain can always be distracted, I want my brain to actually think about something else other than my shoulder, other than my back and my knee or hip. When I'm moving, guys, this is only for moving, okay? So Let me give you just a little bit of background before I show you how to do it or what to do. Imagine if you're walking through a forest and you step on a thorn, you would feel that thorn. But if I had a bear chasing me and I'm running and I step on that thorn, would I feel it? Absolutely not, because my brain is prioritized. It's actually thinking about the bear rather than the thorn. We actually had a guy in his 60s with neck and shoulder pain. This is a great story of how the brain can be tricked. And this gentleman came in with neck and shoulder pain. We took an X-ray of his neck, and when we took the X-ray, we found a bullet in his neck. And he's like, no, I would know if I had a bullet. It turns out when he was fighting in the war, taking care of his fellow soldiers, when that bullet went in his neck, he never felt it. In fact, he carried that bullet with him for 40 years. All right. So I shared this with another family, and she told me, yeah, my husband had a bullet in his calf for 20 years, never felt it, carried that with him. So remember, the brain can always be distracted, but you will say, oh, Matt, that's only because of adrenaline. If I had a bear come in here, of course I wouldn't feel my surgical joint. But get this, they actually took mice, they put them on a hot plate. That mouse scampered off in a minute. Same mouse was given a piece of chocolate. That mouse stayed 2 minutes on that hot plate because it was distracted, okay? So yeah, you can actually use chocolate, right, to help distract the brain. Now, endorphins play a critical part in pain management. In fact, research shows that those who have chronic pain actually have less endorphins than those who don't. So if I were you, I would look back on my week and did I get sunshine? Did I get laughter? Did I get sleep? Did I actually have a wonderful meal? Did I have a good time? Did I go out on a date? Did I actually do some things that are endorphin producing? Did I lay in a hot tub? Things like that. Again, that's for later, right? But the number one way, the best way to get endorphins, because you don't have to need any external input, is diaphragmatic breathing. That's part of the reason that works so well to calm the nervous system down. So when you do this technique, though, it's not so much about the endorphins, but it's about distraction, okay? So if I were you and I wanted to actually not feel my hip or my knee or my shoulder or my back as much, what I would do is I would get the brain to actually focus on my lips. And here's what I would tell you to do. Now, if you're a weightlifter, you know this, but if I'm actually lifting a heavy weight, would I hold my breath? No. I would actually exhale. But when I exhale, I don't want to just exhale. I want to actually feel it in the lips. So if I just did it, it would not work. So what I want to do is if I'm actually getting up, right, for the first time and I'm actually going to hurt, or if I'm walking and I'm like, ow, right, I'm with the walker and ow, and I'm making fun. This is what we see when we're in pain, right? In fact, I had an individual who walked 6 feet, didn't come to class like you, also thank you for coming to class. She came to class, she didn't come to class, and she only walked about 6 feet. And after teaching her the technique about using the lips to kind of distract the brain, this individual, same individual, 5 minutes later, after learning the technique, she was able to use the technique to walk 80 feet. So what does that mean? That means quicker recovery. That means more blood flow, right? That means less threat. Okay, so everything's going to work better, right? So if I were you and I'm getting up, what I want to do is as I'm getting up, I want to actually give my brain that different input. So here's how I would do it, okay? And again, you got to do it before you move. So if I'm getting up and I know it's going to be ouch, I want to actually do this instead. I want to actually, as I'm getting up, I want to actually take that deep breath and as I get up. And that lip feeling is so powerful because, again, the lips are the most sensitive part of the brain. That lip feeling overrides the knee or the hip. Is your pain going to be a zero? Not necessarily, but it will definitely help you be able to move better and then allow you to be less threatened when you actually try to move. And again, give you that better oxygen and blood flow along with the breathing that you're going to be doing. So according to the next slide, we can see that technique, we coined it timed breathing, or as one of our therapists says, blow as you go. So as you're stepping, as this individual who walked 80 feet with the walker, as they're stepping, they have a choice. They can either grimace or they can actually distract the brain. So, okay, walker, right leg, and you might feel a little conscious about that, but don't, because all the nurses know about it, and all the other patients will be doing it alongside of you as well, okay? And then the last thing I will say is, even though these techniques are very, very beneficial, it is not a replacement for pain medicine. We find that the pain medicine and these strategies and your understanding of pain physiology will help you have the best outcome. And I thank you so much for coming. I hope you have a speedy recovery.